Hi everybody, welcome to this week's episode on women's health, fitness and training. I wanted to be like, I am your host, but that's a bit lame. Today we're talking about what are the benefits of training during pregnancy. So first thing I want to say is that weight loss goals are not appropriate during pregnancy. So that's a pre-pregnancy thing. If you are someone that is currently struggling with your weight and you're planning on falling pregnant, please think about your weight loss goals now, because it's not appropriate to do the amount of training and calorie restrictions during pregnancy. So the benefits of exercise. Lots of GPs are telling women, they're a bit old school and they're saying that women shouldn't train when they're pregnant. However, it is safe and it is appropriate and highly recommended for women to exercise because of some of the health benefits that come purely from exercising. Well, not purely, but they're coming from exercise and it's beneficial for you. So if you're seeing a GP that's telling you not to exercise for no reason at all, as in like there's nothing wrong with your pregnancy, you've got no risk factors at all, you're just cool, I'm pregnant, maybe get a second opinion on that, because I would highly advise you do something other than not train, but obviously still your choice. But there are lots of benefits, so let's quickly get into those. First important benefit is gestational diabetes is basically diabetes that is brought on by pregnancy. You are in a really big energy producing state. When you're pregnant, you are building a little human. You need and use a lot of energy. So that puts you at risk of gestational diabetes and can just come on for no real apparent reason other than, you might not even have diabetes before this. So it's just caused purely from being pregnant. So exercise is a really beneficial way to help manage gestational diabetes and help prevent if you are someone that is at risk of this. If you start exercising like really early before you fall pregnant, your risk for actually developing gestational diabetes is in fact lower. So you can do a lot in that pre-pregnancy period in order to offset risks associated with that. However, you can start exercising during pregnancy to help manage it if you actually get it, or even just prevent it from coming on. So number one health goal, or health benefit, sorry. Preeclampsia is also something that can develop in women during pregnancy, or high blood pressure, mostly during geriatric mothers, which is old mums, but still not even old, so I don't know why they call that. It's a bit offensive, really. So yeah, we can use exercise in order to help manage and prevent the risk associated with preeclampsia. So that's another top one. In terms of the mum, it is really good for managing any weight gain that you have during pregnancy. So not about weight loss, but we're preventing too much weight gain during pregnancy. Exercise is going to help combat that. It's also going to help you build some functional strength. So you're going to maintain fitness if you're already training, or build a little bit of strength if you're not really doing anything at the moment, or you weren't doing anything and then you decided to start, because there's going to be a lot of things that you do in your postpartum period that require some pretty good strength, like carrying your baby all the time, picking him up him or her off the ground, carrying strollers, pushing strollers up hills. If you're having twins, that's even harder. Moving cots around, carrying like portable cots, like carrying shopping and your baby, like all of that stuff is like can be quite draining on the body. And if you're not very fit and strong, it's going to be even more difficult. And life as a mum can already be quite tough. So you don't need anything more. In terms of your pelvic floor and core, that is all at like a little bit jeopardized during your pregnancy, if you didn't already know. So your risks associated with the incontinence go up. And doing exercise, especially appropriate pelvic floor work and core work, is going to really help minimize what's going to happen in the postpartum period, and also help with the recovery in that postpartum period. So that's a really great bonus, because no one wants to be incontinent. That is not fun at all. And it's not a common, it's actually just a common thing. It's not actually normal. So if you're currently already postpartum and you're incontinent and you're like, yeah, it's normal. No, this is not normal. You can actually do something about it. So please get in touch with someone and get that fixed and work on it, because it's just a common thing, okay? It also does a whole bunch of good things for your baby's health in terms of like how big the baby actually grows, or too much if you're not really doing the right things. Risk factors associated with diabetes later on in life for the baby. A lot of exercise has proven to show pretty good results in terms of lowering that risk factors associated with that too. So not only are you doing yourself a benefit, but also the baby is gonna thrive off you exercising, as long as it's appropriate. Remember that in terms of intensity and the exercise prescription itself. Postpartum depression is something that we can also help manage with exercise. It's really, really great for the mental health. So even just reducing the depressive symptoms that you might be feeling during pregnancy, if you are feeling that, it's really important that you get onto that during pregnancy. So seeking obviously medical help and advice, and also using exercise as a form of like physical therapy that can actually help like hormonal responses and basically make you feel a lot better. So it will help reduce those depressive symptoms if you get those. So yeah, exercise is a absolute gold mine in terms of exercising during pregnancy. There are so many benefits to it. Those are just sort of like the most common ones that you would probably care about at this point in time. So please, if you are currently pregnant and you need some help, get in touch. Please see your GP if you want to get a little bit more help, and then get in touch with an EP, exercise physiologist, if you don't know what that is, to get some appropriate exercise prescription for you, because it's really important for you and the bub's health. Otherwise, I hope this helps. See you in the next one. Bye.